My name is Kelly Pfeiffer. I'm with the California Healthcare Foundation, and we're delighted to welcome you to our webinar on sustainable funding strategies for opioid safety coalitions. Our goal with this webinar is to share some of the variety of ways that coalitions are funding their activity. As many of you know, a lot of coalitions are funded through blood, sweat, and tears and in-kind support and champions and people working long hours. But the core to a successful coalition is having some type of administrative support, some type of funding to allow the infrastructure, nuts and bolts of just getting things done to work. So that's setting meetings, taking minutes, tracking next actions, tracking SMART goals, managing web dashboards. All those things don't happen without funding. And CHCF is very proud of the work that you all have been doing. I have to say it's a little breathtaking to imagine it was just a little over a year ago that we had this idea that there's great work out there, and what if we pulled all this work together in a network and had people learn from each other. And it just, we get such warm hearts all the time from seeing the work that you're doing and fighting this terrible epidemic. So our goal with this presentation is to share some strategies we've heard of, and we know that there are many experts on the phone, and many of you have maybe thinking of things that we haven't thought of. So while we can't unmute everybody because it would be a bit of a cacophony, we do want you to participate, and there are several ways that you can do so. One is you can use the chat box, and we encourage you to use that. Yeah, actually, let me go back in order. So if you went straight into housekeeping, so let me actually pause for a moment and remind you that our speakers today, first I'm going to get started and share some of the things I've learned about funding. Dr. Matt Willis, a public health officer at Marin County and one of our mentors, is going to share how Marin County has funded itself and also share what he's learned as a mentor from other coalitions and what strategies they've used. And then we're so excited to have Supervisor Katie Rice from Marin County share her perspective on the Board of Supervisors. As Marin, one of the ways they got started was a partnership with the board who gave them some core support since opioid addiction and overdose death became a top priority for that county. Okay, now into housekeeping. What we really would love your participation. So there's several ways that you can participate. One is if you have a question, you can raise your hand, and there's a way on the right-hand side of your, on the webinar, you can see hand raising, and if you raise your hand, then I can selectively unmute you. You can also ask a question, and we'll work to getting those answered within the course of the webinar, and we do commit if there's questions we can't get to that we will respond by email and make sure you get your questions answered. You will have all of our email addresses at the end, so you can also reach out to us individually. And finally, the chat function is a great way to share information with all participants. So for example, if you have a funding source we have not mentioned or an idea we have not mentioned, please use the chat box and have that set to go to all participants so everybody can see. If you have a logistical question, like the webinar is just not working, just chat to the host. But otherwise, these are the ways you can communicate with us: raising your hand, asking a question, or using the chat function. We do want to highlight that we have a couple webinars coming up that you may be interested in. One is all the coalitions have made amazing progress on prescribing guidelines, but medication-assisted treatment with buprenorphine has been really, really tough. So we are going to be committing ourselves over the next year to sharing resources more and more on MAT. And on March 8th, we'll have a webinar on using the hub and spoke model as a way to have specialty resources available at a hub and then primary care resources available at spoke. And then many of you may be aware of the concept of academic detailing, which is brief in-person visits. Pharma has learned these are incredibly effective at changing prescribing behavior, and so we're now trying to do the same thing with evidence-based related to the opioid epidemic. So I'm going to now get started into funding. So I think all of you are familiar with the CHCF grant, admittedly modest, but a year ago we awarded grant funding to, I think it was 12 coalitions, and that funding runs out in May of this year. We were really excited to hear that many of the coalitions that we were not able to fund immediately joined our network by getting funding from their local health plan or from their county or other sources. So we've already seen a lot of creativity and coalitions making sure they have the funding to do the work. So we thought it was a good time to talk about alternative funding, since I don't think CHF is going to be able to continue doing any kind of core funding of coalitions. Honestly, this election has changed some of our priorities, and we have to devote more resources to protecting the gains we made in the Affordable Care Act and universal health care coverage. We still would like to be able to offer help to the network in the form of trainings and technical assistance and giving you all opportunities to learn from each other. So we're hoping that work continues. But after May, for core support, we're going to be asking people to try and find other ways to get that funding. So the closest fit, of course, is the state California Department of Public Health. Now, they got a really great grant from the CDC, and they're using some of that funding to support local coalitions, and that application is due in just over a week on February 10th. And so if you are a coalition that would like to seek out the California Department of Public Health funding, it's a smaller grant. It can't fund all the activities of the coalition, but the thought is that it could be supplemental to other funding. And strong applications will show that they've got other types of support, both in-kind or other funding sources. And so please do go to that link if you're interested, and if you have any particular questions about that grant, let us know. There's more and more federal grants coming down the pike, and grants.gov is the master database of all of these grant opportunities. And as you know, even with our stalemated, frustrating federal government, opioid addiction, thank God, is still a priority of all parties. And so the CARA, the Comprehensive Addiction Treatment Recovery Act, did pass recently with a lot of funding, and so we're starting to see some opportunities come out of that funding. And SAMHSA, the Substance Abuse and Mental Health Administration, also has different types of funding opportunities. And I just picked out 2 types of grants out of grants.gov that may be of interest. And of course, these grants are not completely in alignment with the way CHCF has framed the coalition work, but certainly could be supplemental. They're more focused on prevention. So there's one focused on prevention of opioid misuse in women. There's another, drug-free communities, and this has actually been one of the funders of opioid safety coalitions that have existed for a decade. And so as you know, there's been incredible grassroots work in communities related to preventing opioid abuse and overuse and addiction, and the medical community is a little late to the game. So it's been very exciting to see the medical, some of the coalitions that we've funded led by medical community or public health or independent practice associations or medical societies join with these coalitions that have been doing this work for a long time. So if your county does not have a drug-free community grant, I do encourage you to look at that website, and you can see what kind of prevention activities are covered, and you can get refunded for up to 10 years, and the details are there. So next slide. So we've covered just briefly state and federal, and I just wanted to highlight another opportunity with from CARA, and this is called site-based grant programs. And I'm not going to go through this in terrible detail. You certainly can go to the link and find out more. Next page. What I did do is just highlight the different categories of activities that are funded with this new grant. There's a little bit more time to explore and apply, as it's not due until April 25th. Many of these would only apply to state agencies. So for example, California Cures, the Department of Justice, who runs our state database of prescription medications, is looking into the prescription drug monitoring program, the PDMP implementation. So some of these don't apply to local coalitions, but others do, and others do allow local government or local coalitions to apply. So that may be something to look over. Next. So, you know, as I became a philanthropist only 2 years ago, and the more I learned, the more I realized how much funding is out there, and also in family and private foundations who tend to operate differently, sometimes more flexibly than large state foundations like ourselves. So there's 2 sites that have lists of foundations where you can find out what types of activities are funded, and so many of these, especially family foundations, are local and only fund in their own area, so way too many that I could list, but that may be something to explore. When we last looked a couple of years ago, there were not a lot of funders doing this type of work, and as the opioid epidemic has consumed more and more of the national attention, we are seeing more and more funders get in and want to make a difference, sometimes with just a youth focus, sometimes with more narrow addiction focus, but certainly worth looking at. And finally, getting very, very local, there's some opportunities that are very specific to your county. Local corporations and organizations often do have charitable arms that are interested in investing in their community, especially those who have a lot of workers in that community. As we know, the prevalence of addiction and prescription misuse is growing. More and more companies are waking up to the fact that it's affecting their workforce. So a simple thing of reaching out to the executive suite of a local organization that has a workforce there, you may be surprised by their response. We're also excited to see more and more health plans stepping up. Certainly Partnership Health Plan has been a big player in coalitions. They've worked very intensively before our work got started, and then certainly afterwards, funding now almost every county in their network is either has some support from CHCF or Partnership or both. So we've seen a lot of interest from the Medi-Cal managed care plans and some of the private plans as well. So if you, because I used to be a chief medical officer at a health plan, I do have a lot of these connections. So if you are interested in getting a personal connection to your local health plan, that's a Medi-Cal plan or any of the local commercial plans that are active in your network, please do feel free to email me. And I don't know everybody, but I certainly will connect you when I can. We've also seen several coalitions fund themselves from criminal justice departments, and this is especially true in Pennsylvania. Mm-hmm. I forgot to put this on here, but if you ever want to be inspired, Google Overdose Free PA. Overdose Free PA is a website that was created from funding from Pennsylvania local government and from criminal justice, and they got together an amazing website of technical assistance resources. There's lots of good stuff on forming healthy coalitions there. And certainly we've seen some coalitions partner with their local criminal justice department and have some sustainability options there. For those of you who have public or district hospitals in your region, there's something I won't go into the details. It's called PRIME funding. It has to do with a Medi-Cal waiver from the federal government. The bottom line is some of these hospitals are actively working on better, safer pain management as one of their core requirements to get this funding. So we've seen some coalitions partner with their district hospital and direct some of that funding to this kind of coalition work. And finally, a really great opportunity is with community benefit, and Matt Willis is going to go into that next, and that's the obligation that local hospitals have to invest in their community. So thank you. If you have any questions from that talk, I will be looking at the question and answer. For those of you just joined us, don't forget you can use the chat function or the question function, or you can raise your hand and we can unmute you to make sure that you have a chance to ask your questions, and we'll have a little more time at the end as well. So again, Matt Willis, the Public Health Officer for Marin and one of our lead mentors in the Coalition Network. Take it from here.
Hi, everyone. Can you hear me?
Yep.
Ellie? Okay.
Yep, you sound great.
So hello, Coalition leads and others. I'm going to be really drilling down more into this, the community benefits dollars that our local hospitals might offer us to support our work. I'd like to start with actually trying to use our chat function. If any of you have community benefits dollars being invested in your coalition at the local level, if you could put that in your chat box and switch it from organizers and panelists only so that it's actually shared across so everyone can see, that would be great. I don't know if we have a great sense of how many coalitions are actually already taking advantage of this opportunity. And then we can get back to that in the answers depending on what people have answered. determined that if hospitals are not required to pay taxes because they are classified as charities, as not-for-profit hospitals, there needs to be some compensatory benefit to the community. And they've put a mechanism in place for that form of investing. So I'll be using the term community benefits dollars to sort of be that funding that they would offer. The community benefits process happens in 2 stages, and I think strategically for is the needs assessment that the hospitals have to perform, and then the implementation plan they put in place to actually determine how they're investing their money. So this is IRS regulated, recently expanded under the ACA. So there may be obvious concerns about with the recent changes in federally what the future of community benefits dollars might be. Importantly, this was put in place before the ACA through the IRS, and so we hope that it will survive any changes in ACA. When I try to determine what the changes might be under the new administration, next slide. This is what I found in our search results. So looking at the White House website for community benefits, it thanked me for my interest in the subject, and didn't offer any other information except archived information from the Obama administration. So a question mark hanging over the future of community benefits, but again, it's something that was in place before the ACA. It was interesting to hear Ryan actually mention the opioid epidemic as a reason for needing to strengthen our borders. So I felt encouraged that if they're using the opioid epidemic as a talking point around some of the other strategies, that's something that is probably going to survive as a priority into this next administration. Next. So the Community Health Needs Assessment, the CHNA, this IRS defines it as a systematic process involving the community to identify and analyze community health needs and assets in order to prioritize those needs and to plan and act on unmet community health needs. The CHNA has both quantitative and qualitative aspects, so there are focus groups that happen in the community as well around this. It happens every 3 years, and the results have to be made widely available to the public. So next slide. So a clear first goal for us, if we're trying to get community benefits dollars to help our coalition work, would be to ensure that the opioid epidemic is actually reckoned as a local public health issue in the community needs assessment. There are strategies, I think, that we can consider for that to occur. One is that we first need to learn about what is the CHNA process. The IRS is not, nor through the ACA, particularly specific about who performs the CHNA and what the exact mechanisms of that process are. So it's something that you'll have to learn about, how that occurs at the local level. And then, of course, your own, the call to action that we've all talked about trying to develop for your coalitions really finds an important, piece here, which is we're wanting to make sure that the data that you have to describe the burden of the opioid epidemic locally is easily available and becomes part of the CHNA. You can rally community awareness, concern with that call to action, and taking advantage of voices within your community of existing advocacy groups. HIV, in Marin and other communities, the HIV advocacy group tends to be strong, and there's a lot of overlap between the interests of that group and ours, and the substance use community. And then, of course, attending CHNA public forums. Along the way, most communities, as part of their needs assessment, will actually hold public forums where people can offer feedback in terms of what the community needs are. It will be important to determine when those are occurring and that you have members coming and discussing and talking about the issue. Next. So if you're able to get into the needs assessment and have the opioid epidemic recognized as a local community need, obviously the next goal is to have the hospitals invest in your coalition. The implementation plan is defined as the hospital plan for addressing community health needs identified in the community health needs assessment. So basically just saying straight out of the needs assessment, what are you going to invest in? The definition of community benefit is really loosely defined and locally defined. So it's important that people recognize that a lot of the hospitals can invest that money in uncompensated care almost primarily. So care that has occurred or will occur for which the patients did not have insurance. I'm not sure if others are seeing what I'm seeing on the screen, but there's an overlap on the slide right now. There we go. But the IRS does have some specificity around the language for what community benefit spending must include, and that is the promotion of health for a class of persons sufficiently large so the community as a whole benefits. So I think there's an advantage there for opioid coalitions in that some of the data we've shared where the deaths are really seen as the tip of a much larger iceberg. With the CDC data that says that for every death from an overdose, there's up to 1,000 individuals who are affected by this. So it's not hard for us to, I think, really make it clear that this is a large burden across the community, and that is one of the criteria for community needs for investing community health benefit or community benefits dollars. So next. So how do we actually, sort of strategically align ourselves with community benefit spending? I think one is just you need to learn about what their funding process is locally. The hospital website for all not-for-profit hospitals should have a description of this and where they're spending their dollars and what the process might be for applying. Some of them do an RFP. In Marin County, there's an RFP process. We receive, between $10,000 and $20,000 in a given year over the last 3 years through this mechanism. Sometimes dedicated, and I'm speaking about the RX Safe Marin Coalition. Sometimes dedicated to hosting a specific support for a specific activity, like hosting our annual meeting or other activities. The hospitals consider various criteria when investing in their community benefits because there's so much flexibility on their end in terms of where they would. So there's obviously the intrinsic need in the CHNA, but there's also the consideration of the public relations. This is something that hospitals will, and you'll see hear it on the ads and the radio, et cetera, will advertise as something they're doing to give back to their communities. So something that has oomph and reckons as a community benefit is something they're more likely to support. So again, your call to action and your ability to sort of rally the community's concern around the opioid epidemic will make it more likely that the hospitals will recognize public relations benefit in investing in your strategies. There's also the consideration of the fact that most of the investment to community benefits is one-time funding, like 1 year allocations. So thinking about strategically about what can be impactful over a 1 year period, and then also considering that not-for-profit hospitals, bottom line, suffer from the fact that there's a lot of uncompensated care happening in our current system with the number of people who are uninsured and underinsured, and the fact that people who have substance use issues are often using the hospitals and emergency rooms in really inefficient and disruptive ways. And if you can demonstrate that your strategies are actually helping address that problem through prevention, through MAT or naloxone or community education, et cetera, there's a win-win there because it has both the community need, it has the public relations benefit, and it actually may affect something that's the bottom line in terms of reducing unwanted visits. Next. So one way to find out how your hospitals are spending their current community benefits is the IRS requires that they're all posted, easy to find and available, and you should have a look. If you want to see an example, there's a link there to the Marin General Hospital website where RX Safe Marin's work, I think, is around page 10, and it's just a couple paragraphs on what they're doing for our coalition. So that's all I have on community benefit. We can get to any details in the question and answers. We're going to now speak briefly about one super exciting little thing that we're doing in Marin. Next slide. And this is not funding. This is more along the lines of taking advantage of local resources to get something for nothing. This is a hackathon, which was a new concept to me as of a few months ago. But we are having a hackathon in Marin County on April 1st, where we're actually inviting some of our high school students who are data-oriented, tech-oriented high school students to help us develop an app that might help advance our coalition work. I was able to sort of offer them two problems that we're facing in Marin County, and asking them to help us solve those problems with data. And people who need treatment through medication-assisted treatment to providers who might provide that treatment, and the other was connecting people with pain to local resources for non-narcotic pain management. So that that full array of sort of healthier options for managing pain than a narcotic. So the way this works is that we were reached out to by another one of our supervisors in an area where the high schools in San Rafael were interested in helping advance our work, and they asked if we would offer them a prompt and some data to help us to actually develop an app. We pitched that problem. They're going to gather on April 1st at one of the high schools and spend a day basically working together in teams to develop a tech solution. And at the end, there's a award offered for the best app. These have been successful elsewhere, and some of you may actually have already been involved in hackathons. But the prizes are, typically, between $100 to $500 for the best solution. So it's not a major investment on our end as a coalition, and in fact, we're not spending anything on this. Someone else is actually funding the awards. But we're hoping that the result of this will actually help benefit our work, and it really is a good way to get our message out there. There's a lot of kind of interest in the community about this idea of a hackathon, and for us to educate our youth about the nature of the problem. I suggest you could reach out to your high schools or colleges to suggest a hackathon. It's vocabulary and a concept that's familiar to most people in tech. So that's all I got. Now I'm going to introduce Supervisor Katie Rice, who has been one of our real champions of our, since we began 4 years ago. I think one of the reasons RxSafe Marin even exists, and maybe was one of the earlier coalitions to develop, is that we were partly being driven by visionary leadership at the supervisor level. And another example, I think, of her commitment to this work is that she was willing to bravely step up and participate in this webinar to help others understand how they might more effectively reach out to their elected officials. So, Supervisor Rice?
Yeah, hi. Thanks, Matt, and hello to everyone who is out there. And I just have a couple slides, and then I'd be happy to answer any questions. But for me, and I don't know where each of the coalitions represented, where you are sort of in your evolution of development, and obviously, as Matt mentioned, the RxSafe Marin Coalition was sort of ahead of the game here on the opioid crisis, and there was not as much, I think, information out there in the mainstream media or awareness generally of the issue. So, I think that played into how we evolved and why government got involved, I think, fairly quickly. But for me, it seemed pretty obvious that it was a no-brainer that local government and specifically county government would be concerned, interested, and involved in addressing the opioid crisis. I mean, it at its most basic, it's a public health issue. It's a public safety issue. You know, our law enforcement people were aware of the issue, our probation folks. It's an environmental issue if you just start to think about where some of the opioid misuse starts right out of the medicine cabinet, unused, unwanted, or poorly, or medications not disposed of properly that potentially get into the environmental stream, if not the public health stream. And also it's really a good government issue in terms of fiscal responsibility. As Matt mentioned, the cost of dealing with overdoses, the impact, the sort of collateral damage that happens within a family that spreads into work issues when folks are dealing with someone who is an addict, and the disruption that causes, it ends up affecting pocketbooks both personally and publicly. So, as I said, I thought it was a no-brainer for the county to be involved. And then personally, it was easy to really jump in on this, and the more you talk about it, the more you realize how we each have, as you all learned, a personal connection, either know someone, have a family member who's become addicted, have a family member who has overdosed, or know someone. I have 3 children who are in their 20s now, and at least of my older 2 kids, they each have friends who have died as a result of opioid addiction, overdose, or complications. So it was pretty easy for me to become a champion, and as we saw here in Marin County, it was a really good way to get the issue on the public radar and to raise awareness more broadly through the public forum that the Board of Supervisors Chambers offers, and as a way to use that forum not just as a bully pulpit on the dais side of the equation, but also to create space in that public space for individuals, members of the coalition, or just members of the community to come up and talk about the issue and start running that flag up the flagpole per se. So in our case, once the personal emotional case had been made on that public stage, it was quite easy to ask for a relatively small amount of backbone dollars from the county's coffers and our discretionary funds. And Marin County is a relatively small county. We don't have an enormous budget. And there's always discretionary dollars floating around somewhere, whether it's in the health department, or within just the Board of Supervisors budget or the Administrator's Fund, or frankly, this money could have come out of our probation department through AB 109. I think they probably could have thrown some dollars at this. But what we did is we made the emotional case, and then I just put it on the radar in a very public way as an ask to my board to support funding in an upcoming budget cycle to support basically the backbone for a couple of years of our coalition. And once we put some money towards the coalition, we were able to take other actions such as adopting resolutions or inviting report outs by the coalition on that public stage to continue to keep the public awareness pretty on high, and then also to take sort of some of the symbolic acts that help continue to move the issue forward. So I thought it was really important that the county have not only our skin in the game with regards to symbolic acts, e.g. resolutions, but also to throw some money at it as well, because once you're starting to put money into a project or a program, that's the first foot falling, and you're going to continue walking down that path, especially if you have success. And then finally, and we can go to the next slide, it's sort of running through what I'm talking about now. it was really important, I thought, for the coalition to have the support and the backing and the relationships that the County Board of Supervisors provided in terms of links and bridges to other electeds and policymakers. And I think that's been really helpful, not only in terms of supporting the coalition work, but in raising awareness beyond beyond the county itself. And when it comes down to it, the policymakers and the electeds have relationships that are much different than the staffers and the folks who are part of that backbone stakeholder group that forms the coalition. And it was really untapped, that whole level of policymaker and electeds that reaches out beyond just the local municipalities and into other counties and more regionally, is, I think, really critical and is going to be critical going forward towards ensuring that the opioid crisis addressed and continues to be addressed and evolves and actually becomes integrated into the county public health functions as opposed to being driven by coalitions, which are important. It's going to have to be part of the basic work plan, I think, frankly, of government going forward for quite a while, because it's going to take a while to unravel. So I think that's pretty much what I wanted to say, and I'll kick it back to our leaders on this call and to anybody who is on listening for questions.
Thank you so much, Katie. It's so helpful. One of the things we found about coalition work is often people in the same communities are all interested in doing work together, but it takes someone to reach out and make that first move and connection, and they often find that the very willing and helpful partners. So we're going to unmute the line since we have a relatively small group. Please do mute your telephone if you are not talking. If it gets too noisy, we'll have to mute everybody again. But for now, we'll unmute the line in case anyone has a comment. Again, please mute your phone if you're not talking. As a reminder, we will have the presentations and recording available on our website. So if you came late or you want to share this with anyone, we will get that out to you. You can use the slides. So you can then directly click the links. In fact, if you want the presentations today, I see one request. We'll send you by email now, so you can click and explore those links. So any questions or comments? You are unmuted. Looks like we're individually going through and unmuting you. So if you speak up, if you questions, comments? Sounds like someone's driving, so if you are driving and not talking, please mute your phone. All right, we'll keep the lines open for just a couple more minutes. Again, we welcome questions, comments, suggestions. If you have a method that you've used to fund your coalition that we did not mention here.
Hi, this is Michael Wagner.
Hi, Michael.
I have not been able to get funding yet for our small working group in San Diego. We are a group of about 12 at this point that started back in December with our first meeting, and we had our second meeting the end of January. We are able to get some tips on funding from the current syringe exchange program in San Diego County. That's been the focus of our work to date, but it turns out that just getting funding for a syringe exchange program is probably more difficult than getting funding for a more broad approach such as the opioid addiction phenomenon. So I guess and one specific.
Great. I'm glad you spoke up.
The possibility of managed Medi-Cal providing funding, support, or resources. I was reading through the California Society of Addiction Medicine, and I guess this really is not so much a question as a comment and a question, and they were saying on their most recent newsletter that not a single provider of medication-assisted therapy gets reimbursement through Medi-Cal, and I guess my question is, do you know why that is? And then the question for Supervisor Rice would simply be, in San Diego, if you happen to know the supervisors that would be amenable to, being a pro.
Great. So let me actually take that. This is Kelly Pfeiffer, because San Diego has a very organized and robust coalition called San Diego Safe Prescribing. And if you haven't been in touch with them, we can connect you to Ronit Lev, their leader. They have been mostly focusing on the medical community and lowering inappropriate opioid prescribing, but they're making a new and solid commitment to addiction treatment. They also have done a great job of connecting with local government and would know, if you're not already connected with the county behavioral health resources that might be interested in needle exchange, they would be the place to go because they already have a very strong infrastructure. And they may have already reached out to their local board of supervisors. I'd be surprised if they didn't. So Katie, speak up if you know personally people in San Diego, but I'd recommend that you connect with Ronit Lev, and I can do that with you offline. We had let me actually answer that question about addiction treatment. In Medi-Cal, buprenorphine is available in Medi-Cal. It has to do with the funding source. We're going to have to mute people if they don't mute their line. Please mute your line. So you can get buprenorphine treatment on Medi-Cal. It just has to do with whether it's the actual prescription, which goes to one place at the state, or whether it is the physician or clinician services, which is paid by managed Medi-Cal. So it sounds complicated, but the bottom line is that all addiction treatment is covered on Medi-Cal. It just sometimes the person who the organization paying for the service may vary depending on whether it's a prescription at a pharmacy, which goes directly to the state fee-for-service system, or if it's a service at a primary care office, which goes under managed Medi-Cal, or if it's treatment in a narcotic treatment program or specialized drug treatment facility, and that goes through drug Medi-Cal. So it's confusing, but the bottom line is it is covered. We had a couple questions come up. One is, are community benefit dollars available year-round? And that would be probably depending on the funding cycle of the individual hospital. If you see in the question and answer section, Stephanie Kreider, who is a community benefits specialist, has put some advice in there about how to access community benefits. Again, I think the place to go would be to find the needs assessment and directly communicate with those staff people, because there's always human beings on the other side of the phone, and you'd be surprised, even if their needs assessment doesn't have anything about the opioid epidemic, if you talk to a real person, you may find that the priorities the next year could be different. I had a question, is starting a GoFundMe fundraiser under the Raise Money to Improve Your Community something that can be done? Absolutely, because GoFundMe has been used for almost everything. So that's a really creative idea using social media. Thank you, Carolina. I have no idea whether it would be small or big, but I wish you would try it and tell us how it goes, because it's a great idea. Any other questions or comments?
I have a question for Supervisor Rice, which is, what do you think the most important piece of information that we offered in Marin was for helping get kind of galvanize the interest of the elected? Is it overdose deaths? Is it the fact that young people are involved? Like, what are if folks are trying to develop sort of a key message for their electeds if they're reaching for the first time, most resident? Maybe she didn't hear that.
If you're not speaking, could you mute your line? And Supervisor Rice, are you still on the phone? It looks like we may have lost her.
Okay, yeah, there's a muting.
Unless Katie, you're on your phone on mute, we're not hearing you. If you want to try and speak up again.
We didn't talk about, some smaller. One of the things that just in the last actually few days for us was that one of the local supermarket chains asked if one of our coalitions wanted to be their coalition, and it's something they do for a variety of like non-governmental organizations and they'll highlight there's a certain fraction of their proceeds during that month go to that organization, and they'll have like a little communication about it as a way of giving back to the community. And that was through one of our local supermarket chains. Something I hadn't thought.
Matt, you're breaking up a little bit, but I muted everybody because it got too loud. But for those who didn't hear, Matt was talking about going to a local supermarket chain, and they announced certain community donations to help that community. So Matt, if you're on the phone, do you have any recommendations for how to contact someone? Do you just go to the local Safeway and ask to speak to the manager? Do you go on their website? How would you see if any local organizations, whether they're supermarket chains or other businesses, would be interested?
Yeah, this kind of activity, and looking at the website is probably the best way to figure that out. And you make a pitch for your organization to be featured as their highlighted organization for a given period of time. And it's a good way of getting the word out, and then that you get, the fund would not be major, this, maybe a couple $1,000s, but it's part of the collective impact.
That's a great suggestion. Again, local businesses love being seen by the community as do-gooders, and this is such a high-profile problem. As Katie mentioned, there's not one of us who hasn't been affected by the epidemic personally in some way through friends or extended family. So you may find that a CEO of a local organization is absolutely passionate about this and excited to be able to find a way to help. As many people, I think especially after the election, are really anxious to find something to do to make a difference, and it's great to be able to tap into that kind of passion and support. So we had to mute the lines, but we'll give you one last minute to either chat or put in your question or raise your hand, and we can unmute your lines personally. But just a few more minutes to see if there's any other last comments or questions. All right, well then we'll close it out. We'll be, over the next couple of days, sending all attendees of the webinar a PDF so that you can access those links directly, and within a week, the recording and the slides will be available if you want to listen to the recording or send it to anybody. Thanks again for attending, and we hope that these suggestions have been helpful. And after you hang up, if you think of anything that we have not thought of, please do let us know. We are a coalition of coalitions, and we're always learning from each other. So thank you so much, and have a great day.
Thanks, everyone. Bye-bye.